PBB Healthcare, located in North Parramatta, is a unique integrated practice combining midwifery, general practice, nursing and allied health. The combination of antenatal care, GP services, early childhood services, lactation consultation and women's health allow PBB to offer a single point of service for the practice community. The integration of multidisciplinary teams within children's and women's services allows for enhanced continuity, coordinated and multifaceted patient care.
My name is Jane Palmer and I'm an eligible midwife. I'm the owner of PBB. Now, PBB is a unique practice in the fact that we offer family general practitioner services, eligible midwife services, as well as nursing and allied health services. So we're quite a unique service in this local area. In the fact, with the midwifery side of things, eligible midwives, there's not terribly many of us. As far as I know, there's only about 100 in Australia. And what an eligible midwife is we provide midwifery services that are Medicare rebatable, so that people can come and see us and actually get Medicare rebates. Our business objective is to provide healthcare across the lifespan, not just for pregnancy and after birth. So it's providing really good quality care, so from birth until, well, the end of life.
At first, I had said to my husband, let's just go and meet this person. And I showed him the website and some of what Jane does. And I said, there's no, we don't have to go down this path. We just will do a few steps and see how we go. But after the first meeting, I knew straight away that we were going to do this, and it just felt comfortable.
As I said, providing care across the lifespan and providing very good quality care. We do have a focus on women's health and obviously pregnancy and birth and early childhood services as well. We still have male patients come to the surgery to see our GPs, of course, but yeah, a good portion of them are women, and pretty well across the lifespan, though heavily in obviously in childbearing age and also elderly as well, elderly women. Well, I start because I've got a passion about providing really good quality midwifery care, and then when I saw the opportunity to take over this centre that was already running as a medical centre, I saw a wonderful opportunity to have medicine and midwifery work really well together, and I must say it's one of the best things I've done. The two professions knit really well together.
I think it's something that should be part of every community, not just for women but for families. And I think it should be this sort of a group where there's this support on every side. Like you could buy birthing products through PBB, you get the midwifery service, the GP service, the care for the younger child. I mean, it is so hard growing up in a city without some support, and to have that support and have it not only medical but personal and emotional support as well, I think is really important for mums, regardless of whether it's their first or second or third.
We're probably one of the very few unique services. There are a couple, I know there's one in Queensland, and there's probably the others that I'm unaware of, but there's only a few that currently I know that work in this way. Well, what we've done is, because we're a new service, we've actually gone into the community and we've gone around and met local services such as Cumberland Women's Health Service, other allied health, natural therapists, other GP practices, youth services, any service that we would see that we could be working with, and talk to them to find out what the local needs of the community are. And I mean, one of the things that we've found particularly is very lacking is women's specific health services, but also early childhood services. Interestingly enough, there's the current early childhood services aren't meeting community needs. Basically, there's just not enough nurses out there working in those services, so we can provide those through this centre as well. We wanted to be unique, but also want to meet the community needs at the same time.
Well, when we came here as well, it was great to have the GP here, so I've had a few visits with the GP, with a vet, and that's been really supportive, so coming to the one place and seeing Jane, and that's been great for my family too, because with your first it's a bit easier, but as it goes on it's nice to have everything in one spot.
Well, I said we've gone out and we've seen these other community services, and we're having open dialogue and sort of referring back and forth. They're not official partnerships, but the one partnership we have managed to forge is with Westmead Hospital. Because midwifery services are unique, so what we've done is our GP also is a shared care GP, and so we wanted to set up the same sort of services for the midwives as well. So we've actually worked with Westmead Hospital, and there's now a policy developed at Westmead Hospital where there is now shared care for midwifery care as well. So that's been quite exciting. So potentially there might be some other ways we can forge partnerships with them.
My advice would be to definitely meet a midwife and at least have 1 or 2 chats and understand what the midwife could offer them and their family, and to think about their birth and their pregnancy as something that should have continuous utmost at and that they deserve that. So
yeah, well, WentWest have been very, very helpful. At first, I had no idea what it was to run a GP practice. I thought I did, but just getting head around Medicare and how to run a practice, how to get the best profitability out of your practice, and I found WentWest have been critical in that role. We've attended a lot of their programs, both the GPs, myself, our nursing staff use WentWest very heavily for their education, but also from a business perspective, we've done things like attend, say best practice software course. So that's one of the software programs we use here. So getting the best out of how to use that, we use the PenCat tool, and that's been critical because that it allows us to get data about our patients in our practice, and then WentWest is helping us, with which way forward. So one of the things WentWest is doing for us is our diabetes program. WentWest is actually working with our practice to develop a good, solid, clinically based diabetes program, and that's quite exciting. That's coming up in the next 10 months. Well, from midwifery, or even for the GP itself as well, when the women come here, is that they get continuity of care right across, so they get continuity through their pregnancy. Obviously, the women will go to Westmead to have their babies, and then they're discharged very shortly after, and then they come back to us. And so they'll get continuity care after the baby, and then of course we've got the nurses here do early childhood, so then the women come back with their babies for their early childhood services as well. So it's a real continuity through pregnancy, birth and quite beyond. Yeah, the women rate the service really highly. They're getting good quality care and time as well. We're able to probably spend a little bit more time with them. But the other aspect of not going to the hospital is parking. As silly as it sounds, trying to park near Westmead Hospital is impossible, whereas there's parking all around here. So it's access to them, and particularly if they live really close, obviously, it's the service in the community right where the women live. Each of us here have particular interests. Obviously mine's midwifery, the nurses have different aspects, our GPs have different focuses that they're quite interested in. So we obviously focus our education on our clinical needs, and that ensures high quality healthcare for the patients coming through the practice. But education in relation to running a business, I think, is critical, and that's the thing I found the most valuable, particularly the stuff I've mentioned with WentWest, but I've also gone off and done other courses specifically to running a medical practice, and that's make sure all your systems in the practice are up to date and up to standard, but also, from a business perspective, it's about money, and it's about making money and making sure you've got maximum income for the patient base that you've got. Yeah, so it's been critical. I think for anybody running a medical practice, look outside the square. I think that's one of the things we've tried to do. Looking outside the square opens lots and lots of opportunities. If you'd asked me 12 months ago, would I be working in a medical practice, and I would have said no. And now I've done it. I think it's a fantastic way forward. Medicine, midwifery, and other allied health services work really, really well together. And having it like a one-stop shop really makes it provide good services for the local community.
My name's Catherine Veal. I'm a Practice Partnerships Coordinator for the Western Sydney Medicare Local, and I provide support to practices, both educational and resource support to GPs, to practice managers, practice nurses and administrative staff. I think what's unique about this practice is that it's a clever concept that they've put together here. Jane came into the practice with a really clear idea of what she wanted for the practice. It was something that, a service I suppose that wasn't offered within New South Wales to patients. Not a lot of patients can access antenatal services, and particularly in a private enterprise. So she had a vision, she came in here, she put together a really clever business plan and idea before purchasing the business, and she's worked towards that ever since. Jane didn't bring the business plan to me, it was something that she, I suppose, put together herself before she started the business. Coming into the business, there were a lot of things that she didn't have experience in general practice, even though she'd done a lot of research before she started. There were things that WentWest could, and myself could offer her support in when she did start up and working towards the general practice side of the business. So. I think within general practice, the idea of having a whole of lifespan service to offer to patients isn't so unique from, say, birth to the last stages of life. But what Jane offers here is that antenatal pre-birth level of support to both the baby themselves and the mothers, so that's unique, that's very unique. WentWest is well set up to be able to support general practice and support Jane in what she's doing, in that we've got a lot of knowledge about all of the different areas of general practice. GPs do what they do medicine. They do that really, really well. Obviously, they've got years and years and years of education and training behind them. That's not our role, I don't think. We come in and we're able to support the practice from all different sort of angles, particularly a business perspective. And I think that's what we can offer to Jane here. She's a midwife. She's been in midwifery and nursing for many, many, many years. She's very highly trained in that area. She's got a good GP here that works with her as well. Obviously, she's been practicing medicine for a very, very long time, but it's a new private entity, it's a new business, and we can come in here and provide information and support in lots of different areas, dealing with Medicare, dealing with the Department of Health and Ageing, policies, procedures, that sort of thing. Yeah, so WentWest was able to provide support to Jane and her staff through provision of education. So we run a lot of educational events, both clinical and non-clinical. Jane's staff, nursing staff, have attended many of our co-funded events. We provide funding for nurses to attend all sorts of training. We've had things like wound management, accredited nurse immunisation courses. So the nurses are able to attend those events. We run them very regularly. We've often got, 1 or 2 events a week running. So that's, I think, been a really good thing to be able to offer Jane and her new staff that have come on, particularly as her being a midwife, and there's another midwife also that works at the practice, being out of general nursing services for a long time, they're able to gain those skills back again that they haven't necessarily been in for a while. In regards to, I guess, software support that we've been able to offer to Jane, she started off with best practice software, and the software that is used in general practice is very different to what's used either in hospitals or, not all health services have clinical software. There's a lot of places that still conduct their, write their progress notes and things on paper. So we were able to provide templates, which can then, templates for health plans, GP management plans, team care arrangements, health assessments, that can then provide an outline and sketch for healthcare for patients. yeah, I suppose an extra resource that she can use to provide good healthcare to her patients. I hope that it's able to assist her in a way that maybe she wasn't able to provide or generate herself. So I hope that WentWest has been able to make a good contribution to that. So I think Jane's practice and PBB Health is able to offer a very unique service to the local community. North Parramatta is an area where there's a lot of young families, there's a lot of migrants that have moved into the area, and they're I suppose becoming familiar with the healthcare system. Jane's midwifery service works well into, say, the local hospital, Westmead Hospital. She's able to provide antenatal shared care and antenatal services to a lot of the young families and in the community. I tailored the support to assist PBB and Jane in looking first at, we've had a lot of experience in dealing with practices that are newly opening. So there's a lot of support that we were able to provide around setting up policies and procedures, assisting with setting up paperwork, obtaining all the right resources that you would require in general practice to deal with Medicare, to deal with the Department of Health and Ageing. So WentWest has some future plans to assist Jane in something that she's requested support in linking her in with local services. So the patients that come here also require support services in the areas of allied health sometimes. Jane is looking at having some allied health professionals actually come and work in the practice to be able to provide a more accessible and localised services. Things like speech pathology, she has an Aboriginal midwife that will be starting at the practice, a psychologist that will be able to provide specialised services in postnatal depression and mental health services. So we're able to link her in with services that are available in the local area. Jane has a very good idea already of what services new mothers need, so we're able to assist her with that. So from, I suppose, a personal perspective, one of the biggest achievements that I've seen come through the support of PBB has been to be able to bring to the attention of WentWest the really unique business model and healthcare model that Jane has been able to offer to her patients. That then leads to us being able to showcase the practice and the model to other practices that we engage with, being able to provide them information and support in looking towards building their businesses and creating the opportunity to provide unique services to their patients. Something else that's unique about PBB Health is that Jane has set up online media and promotion for the practice. She's got a website which offers support to either patients of the practice or anybody really that would like to log on to the website and have a look at. There's information about pregnancy, birthing, different products. She also sells products online and from within the practice that are able to support patients in a complementary manner. There's all sorts of birthing products, nutritional products, and that's something that's particularly unique about this practice. I think Jane has a particularly good business model. I feel confident about the way that she's able to progress. She's got a clear vision of what she wants to achieve. She works really, really hard towards reaching that vision and that goal. She's been in practice now for 5 or 6 months and she's still working really hard towards that. So I think the unique business model and the health services that she's able to provide to her patients and the general community will lead to this practice becoming a very, very successful practice into the future.